So tell me about our patient in room 3.
Okay, we have a 49-year-old man presented to the ER with painful urination. He's got blood in his urine. He can tell that he's not completely emptying it. He did describe that. He's had some lower quadrant pain, persistent back pain, and he does have a history of a BPH, which I know is a precursor for prostate cancer. So in addition to normal orders, I would also suggest PSA testing and DRE.
Okay, so for the prostate cancer screening stuff.
Mm-hmm.
Yeah. Okay, so I'm gonna get some urine cultures ordered as well, some CBC, and then I'm gonna perform a cytoscopy. If you just want to let me know whenever I make my rounds. I'm just going to insert a tube up into his urethra and check his urinary tract and make sure there's no evident infections. Upon admission in the ER, we had a DRE ordered and a PSA. I performed the DRE and I did feel an enlarged prostate through the rectum.
Okay.
And so, do you have any other findings for me?
His pertinent lab values were indicative of a risk for prostate cancer. His hemoglobin is 11.9, his hematocrit is 39%, he's hypercalcemic and hyponatremic, and his AUA is 24, and his PSA is 28.
So I say we get a physical assessment done and find out some more about his paternal history of prostate cancer, because I did see that one. Okay, so what did y'all find from the physical exam from earlier?
So on the physical exam, he still has bladder distension, a backache, and lower quadrant pain. His pain is rated at a 6 out of 10.
Is that after the morphine order was ordered?
Mm-hmm.
Okay.
So so he's still
has
having pain.
Okay.
Yeah. And the oncologist has spoken with the patient about the benefits of both the watchful waiting or surgical intervention, and the patient is open to surgical intervention as a treatment. What do you think is the best option here?
Well, I wouldn't do watchful waiting just because some of the disadvantages is like missed chance at a cure, anxiety about the unknown cancer and what it's doing to him. Definitely risk for metastasizing, because if we don't stop it now, then we don't know what it will do. And then just bothering him with frequent monitoring would kind of be not good. But some of the advantages is like increased quality of life and decrease in costs. So I think that is a good option that he's wanting to do the surgery.
Okay.
So I will go talk to him about his radical prostatectomy and get paperwork I need.
Hi, Mr. Martina. I'm a nurse of you today, and I'm going to talk about your after-surgery care. Is that okay with you?
Martinez, your surgery went successfully, and so I'm going to talk about a little bit of how to take care of yourself. And first, you need to look up your surgical sites and if there's any signs of infections. And you're also going to look your urine to see any blood and cloudiness in your urines, and if you find out any unusual, let us know. And also, you're gonna do your proper hygiene for yourself to decrease risk of infections. And also, we're gonna arrange for the psychosocial and sexual counseling and support group related to rectal dysfunctions. And you need to drink a 12-8 glass of water daily, and then you need to urinate every 2 hours. And also we're gonna teach you how to perform the Kegel exercise, and it increase your strength to your perineal muscles. And lastly, that's really important, you need to eat well. So which is you need to eat high fiber food to prevent constipations, and low in fats, and you're gonna increase the omega-3 consumption, so like a salmon instead of a processed meat. Do you have any questions?